Thank you. I'm a two-time moderator, and I'm actually a little bit more nervous actually presenting. And as a moderator, this is an old trick to add time to your 5 minutes as you start talking before you hit the button. But I want to talk to you about my experience in Houston. I was there for 12 days as a medical manager for Hurricane Harvey, and my team went in along with 28 other teams to go take care of victims from the storm. So you'll remember Hurricane Harvey, there was 27 trillion gallons of rainwater and 51 inches of rainfall. And what you may not know is Houston only sees about 49 inches of rainfall per year. My job was to take care of the team, and I don't know what's going on my slides. As the medical manager for Ohio Task Force, we have a team of medics, rescue specialists, law enforcement, canine specialists. We had 3 dogs to take care of. And that was one of the more anxiety-provoking things for me on the deployment, was taking care of the dogs. As a FEMA physician, you do some training, you do some dog labs and things like that, but it was a little bit anxiety-provoking. So all 28 teams deployed to Hurricane Harvey, and this is the map of the 28 teams in FEMA, so you can kind of look at the map and see where the teams are. Ours is stationed in Dayton. And my experience with the deployment was really interesting. I took my 10-year recert this year, and I was in the Ohio ASET board review course the day the storm hit. And I didn't know anything about the storm until I got this email that you see on your screen that it was time to deploy. This was a tweet that I think impacted our whole deployment, and I didn't take this picture or send this tweet. But when people saw nursing home victims in rising water, they were shocked. And the next day after that tweet was sent, we had 2 operations. Our boat's crew was out doing neighborhood search and rescue, and I was back at the base of operations, and Nebraska got a mission to do a nursing home evacuation. So that day we arrived at the Heritage Park Nursing Home. We had 2 box trucks, and I'll show you a little picture of what those box trucks look like. And then 2 National Guard trucks showed up, and we had to evacuate the nursing home. So here's a real quick, it's not going to play. I had a little video from our trip over. We had to drive through a lot of floodwater, and we brought 12 vehicles down with us, and each vehicle broke down at some point during the deployment. The other thing that was interesting about this, as you look at the map of the nursing home, is it was primarily an Alzheimer's nursing home. So a lot of the victims that we had to evacuate were from a memory wing. So this is us in the back of the truck traveling over, and our mission was to get 85 patients, 20 staff and families to this truck stop where there were 10 ambulances waiting to take patients to other places. So here's how we did it. We had our box trucks, which had hydraulic ramps, bring patients up. And you might be able to see the yellow folks. There's actually a patient in a sheet that we're bringing over from there. I had a little video. I just wanted to show you this because I was on CNN, and I'm trying to show it to as many people as I possibly can. And I'm really sad that it's not going to play, but the good news is my kids have seen it about 50 times. So as far as patient identification, you could see in the distance there's a bedridden patient with a pink vest. And Houston did a wonderful job of identifying their patients. Each patient had a vest, and this video kind of shows the patients with the vests. And the vests showed their name, their meds, their allergies, and their advanced directives. And that was huge because a couple of these patients were on tube feeds and were really sick. The other thing that I wanted to mention with this 12-day deployment is just the amazing human nature that we saw. We referred to these folks as the Cajun Navy, but people brought boats, and I can tell you that the majority of the rescues I saw completed in Houston were completed by civilians helping other civilians. This is a letter we got from the fella that is on the back of the box truck who was thanking us for rescuing his family and his pets. And this is the whole group of people who did the nursing home rescue. We were fortunate enough to be on the same floor in the high school with Nebraska Task Force, so these are all the folks that were there. The best reward I had, though, in addition to the 173 rescues we did, the 40 animal rescues, was I was asked to speak at my daughter's 3rd grade as an everyday superhero. So for me, that was the biggest thrill. That and the CNN was big, too. So thank you.
Thank you, Nick. I'm going to butcher this name, and I apologize in advance, but Kman Ioannidis, you're up next. And then judges, any feedback for Dr. Kman?
Nick, thank you so much for sharing your story, and thanks for what you did for those victims. Thank you.